Meghalaya's Chief Minister Conrad K Sangma, along with the rest of the country, launched the vaccination drive here at NEIGRIHMS Hospital in Shillong. There are about 832 COVID warriors who will be vaccinated today, of which 100 of them will be vaccinated here at NEIGRIHMS Hospital in Shillong. The world's biggest COVID-19 vaccination drive was launched by Prime Minister Narendra Modi via video conferencing on Saturday morning. In Meghalaya, the drive was launched by Chief Minister Conrad K Sangma at NEIGRIHMS on January 16. Speaking to media persons, the Chief Minister termed the occasion as a historic moment in the battle against COVID-19.
So very good morning to everyone. Today is a very historic day in many senses. Number one is that we have been fighting COVID-19 for almost a year now, and this has really taken a big toll, I should say, on the nation, on the economy, and individuals' lives, of every citizen of this nation. And today, this vaccine rollout is a very, very positive step towards fight against COVID-19. We have been fighting COVID-19 in many ways, but this vaccination program and the rolling out of this is a historic day, a day to be proud, and a day for citizens of this nation and the world as a whole to feel confident that we will be able to overcome this very soon. Second, of course, it's a historic day because these vaccines which have been made in our country. And I think that has shown the power of the country and India and its scientists that we can also show the nation and the whole world of the kind of work that we can do to fight against COVID-19. So it's been a very historic day from these two perspectives. 832 from the health sector who will be immunized today. 100 of them are being done here in NEIGRIHMS and in the rest in the different parts of the state. And I congratulate them for being part of this program and part of this historic day where they will be the first people to be immunized. And of course, as we had mentioned, it's a process. There are 2 shots to be given, and the immunity only comes in based on scientific records and everything, that immunity will come in only after approximately 45 days post the first vaccine that's given, and second will be given on the 28th day. So therefore, they also have to be careful, and I think all the necessary arrangements have been made. First phase, we will be immunizing the health workers, and in the second phase, the frontline workers, and in the third phase, 50 plus, and people with comorbidities will also be included, and that will be in the third phase. So that is the way to roll out, and as I said again, that is a process that will take time. So once again, I congratulate all the officials from the health department, our officials here in NEIGRIHMS, for having successfully organized this program, and I wish this immunization program the very best.
It was informed that a total of 100 health workers will be vaccinated and 732 in the different districts of Meghalaya.
The world's biggest vaccination drive, and we are proud that it is Be Indian by Indian. And today we have all the healthcare workers, the sanitation workers, the security staff who have been working in the COVID areas. So they are all coming to benefit from this. You can understand they were all worried, they were all tense, every day coming to the hospital, working, and then going back home to their families. And in the event of any rare, when you take any medicine, there is always a chance of a reaction. So that doesn't it doesn't stop you from taking a medicine. You take ampicillin, you take so many medicines, and they all have a potential, and they are similar in risk. But you don't hesitate. So what helps you, you do it. They have been tested, they have been certified for emergency use. Why emergency use? Because it is an emergency. it is an emergency and you need to use. We will not have the luxury of 1 year waiting. If somebody feels he wants to wait for 1 year, 2 years, he is welcome because he can also get the COVID in that period. His chance of getting COVID is more than the chance of his getting a reaction. Let us be very clear. The chance of somebody getting a COVID without taking a vaccination is going to be more than is getting a reaction out of a vaccination. We are doctors, we are nurses, we are aware of what is happening, we have access to resources which tell us whether it is safe or not. When we come forward to take it, you must understand that it is safe.
I have taken the vaccine. I just want to share my experience. No pain, no restriction, nothing till now. I am quite absolutely perfect. Undue afraid and undue fear should not happen to anyone.
Kajing penget yaki ngan suong ba ndai mangi namar ba balai wadadai manu bompat syamphang lane bompat tip nungkong takamut kidon bi kata kajing tiang te mentangi ngilong sisa kum kasti nadu badang don ka lockdown ngi wan tray bet barok ki ben yangi barok ki ting yangi teng ban syong kalilang umlong teng bangin le chiang ro umlong ngi haban sa sini cika tray kisnong ki thau ki marjan marpa ki daong ba samabhase ngidon khulung hieng lane ngidon ki bala temen hieng sa se jing tray kumnu ngin sa sini si jing tray kasim jing yangi kabam ngin yo na ngim yo kabam gadi kecaka sa ngin yo na namar ngidon hane dak sausan hajar ngut kinong tray ha ngin sa dengan ong yaki ba undai kin mantiang ngilong kasti yaki nadu katu kapor ka ba ho ngiada ngimtip bangidon ngimdon rai tu knyang jengpang namar nging tray hospital ngitiang ngi susyong susa akat sebalap sisya tang hane compound jong kani grim hane po hospital te ngen ong yaki ba pet yang ngi mentang ngila sim yo ne vaksin lada syong no lada long side effect lada long ubam biang ngi ngila persyang syua tang bangin ong yaki hane hapo jong ka arpu pras ngi menta kin setip ken bangi ba ne udawai ulong sisya ublayarap ne ubam yarap ngong ngang balang mat yelade ngada kemen sisya hi bangalamat bangala sim ya kani ka ya ne udawai dengan orang iki weiru to pet khai bat pet thu yang ni bangi lamat ya kani kadawai nadu ketu kopor lockdown ngila sim kejing ban ngem kwa syu ban wan syu kum ketu kejing la sim iki belayap la sim iki bepang bestom la dangim persyang mangi menu pat ban persyang ngidei ginong tray jongko hospital om tang bangin yo ke salary la ne ketulop ni tray hang ne ban yadai iki wei ban yarap lem iki wei bat ban pelaj na kita ki barok ki badan ke jemut jempat khat jongki ke basniu ni chong no ya une bar khaj menta la pen kre balai ba ai nongkong yi kinong tray jongka health jongko hospital khnang ban la ban pensyai ki pej ba te dai mangi menta ngila sedang ban sim ya kane ngila longin wan ra khmat ki pej ba une udawai unlong ubapha unlong ubutrekam bat ngidon hiru ke cingkerman ya kata.
The same was also carried out in various districts of Meghalaya.
While countries, including India, have taken strong measures to contain the spread of COVID-19 through better diagnostic and treatment, vaccine will provide a long-lasting solution by enhancing the immunity and containing the disease spread. The COVID-Shield vaccine is manufactured in India by Serum Institute of India Private Limited, Pune.
Since we have been actually longing and I guess even the general public have been waiting eagerly for this to come. It has come very much earlier than we expected, but still it is according to my medical understanding, it is one of the definite ways which we can protect ourselves. So not to be afraid and to go ahead. That is what the call I have taken myself, and by my example I want to encourage each and everyone to take the vaccination so that we will definitely win against this pandemic. Thank you.
The vaccination will also be rolled out in 2 districts, Southwest Khasi Hills and South Garo Hills, which were previously left out due to connectivity issue by Sunday. We have just witnessed the world's biggest vaccination drive from this part of the country. There are 10 session sites over 9 districts here in the state of Meghalaya that have been identified for the first phase of the vaccination. Here at NEIGRIHMS Hospital, both staff and the officials have been vaccinated earlier today, sending a positive message to the public. With camera person Sao, this is Ferdinand Rani for TNT.